Mhm. Welcome back to Torque and Spine Show, my audience. I'm here with Hrovath, right?
Yeah.
Yeah, Hrovath. I want to understand, what is psoriasis? How does it work? Unless you have it, part of the title is, unless you have it, you don't understand how it works. I'm worried about, as I've seen some of your videos too, Dayna, is the physical, the emotional, and the psychological effects with psoriasis, along with, once you get the medical diagnosis, now what type of rabbit hole you have to go through with all the treatments they offer and with the side effects too. How do
Yeah.
we, in the big picture, get back to normal life with psoriasis as being a condition, but not life threatening or life ending? Correct?
hmm
You're my
Yeah.
expert. Let's
So,
go through. How do you treat? How do you walk through what psoriasis is first? Because I understood a little bit, but give people an idea of what it is if you don't have it yet.
sure. Yeah. So, psoriasis is it's a condition from an overactive immune system, and that causes an increased number of T cells in our blood and our skin that cause the skin cells to shed up faster than normal, and they pile up and build up and form these plaques on the skin. And they can be from a bright red color with a white scaly top to more brownish purple type of hue depending on the person's skin tone, and it can affect you from your scalp to your feet. It can affect your nails. No part of your skin is immune to getting it. But not
Mm.
only does it affect the skin, but it also, that inflammation that's in the body increases risk for um, certain types of cancer like lymphoma, diabetes, high blood pressure, high cholesterol. So a lot of times people will think it's just my skin, what does it matter? But it isn't just the skin. Yeah, it affects the whole body. And it's pretty common. It affects, just in the United States, over 8 million people, and worldwide, probably about 2 to 3% of the world's population.
Well, and as you mentioned too, it's something that happens in your body. So is it considered more 100% genetic, 100% environmental, or a combination of both?
It's a combination of both. It is an autoimmune condition, and genetics can play a role, but also a person's environment comes into play for sure.
It's almost like I did talk with someone about epigenetics too, how your environment affects your genetics, a
hmm
combination like that.
Yeah,
Okay. And,
absolutely.
and when you have it, how is it initially diagnosed medically? What do they normally do?
Yeah, typically it's a clinical diagnosis, meaning that a medical provider will look at you and be able to tell you just in your exam, because there are certain ways that we look at it that tells us, oh, this is psoriasis versus another type of rash like eczema or so on and so forth. But occasionally there are some crossovers and it can be in question, the diagnosis. So then a biopsy would be performed to have a clearer understanding of
More
which one.
specific.
But it can be difficult unless you have like the classic knees and elbows. It can be difficult for someone to just guess on their own, I have
Hmm.
psoriasis. A lot of times it is good idea to get your medical provider to give you a diagnosis.
And is there blood work involved too, things like that? Because you mentioned it's more of autoimmune affects the whole body.
Yeah, there isn't a specific marker in blood work that would pick up for psoriasis, unfortunately. There are things in your blood work that can show you have increased levels of inflammation, like an increased homocysteine or a C reactive protein, but that's just inflammation anywhere in your body that's not specific to psoriasis. And another big
Hmm.
one that I forgot to mention is psoriasis also can affect the joints and cause a specific type of arthritis called psoriatic arthritis, and that can be really debilitating.
That can be not only but also quality of life, and I've seen them on some of the X-rays too. I have, when someone has that already, it's almost they have other things going on in their whole body. It's hard to treat just this one thing for one too. Can
Right.
psoriasis be resolved?
There's
If that
not
is at the term.
Yeah, there's not a cure per se, but it can be managed and put into remission to get to the point where hopefully you're doing so well that you really forget that you have it.
Okay. Okay. And then when you do see your doctor and give that diagnosis, what is their approach medically to treat psoriasis, say short term and long term?
Sure. So when I'm describing it to people, I think tell them to think of a ladder. There's different rungs, and the higher up you go, the more aggressive your doctor is being. And the bottom rung is usually topical things, creams and salves and ointments to start from topical steroids or vitamin D analog creams. And then there are other treatments further up. There's UV treatments, getting either into a tanning bed or a UV box meant for people with psoriasis. But risks of that is it's increasing your risk of skin cancer. And
Is you're
um,
talking about those rungs, but it seems like as you go further up those when I was watching Dora to Explore like 1,000 years ago, I was like, this is what rungs are. I never knew what the names were. But
oh,
when those rungs go further up, it's almost it seems like you have more risk as you go further up those rungs.
yeah, yeah. From as you're when you're getting into more internal treatments like oral medications like Otezla or methotrexate. Then there's the biologic class. Those are shots that people get, Humira, Cosentyx. There's a lot of different options, but they can suppress your immune system, increase your risk of infections, liver damage, depression, cancer. I mean, the list is, you see the commercials where they're showing
Mhm.
that happy person um,
Dancing,
galloping
Disney dancing.
around. Yeah, and then it says may cause blah 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 blah.
One of my first commercials I videotaped on my phone and put on YouTube was a testosterone cream. And it was great because it was a 1 minute video. Half the video was the benefits of it can help you with this, this, and this. Second half video talked about all side effects, not have around your kids, and can cause death. I'm like,
Yeah,
yeah, that sounds like maybe risk benefit, maybe a little off here and there.
right,
But
right.
the idea though, right? If I'm taking more medication, doing more therapies, there has to be high risk. And sometimes, again, every doctor is different. They won't be honest or give you the full scope of what the risk might be and how they're going to check them. They're going to check your liver, they're going to check your kidney, they're going to check your blood work every couple of months to make sure it's not affecting you internally, that you're not going to see because now you have a problem to where things aren't working properly. You're not going to see things that are not symptomatic yet.
Hmm.
So going to that and going to how that when has someone has it again, still the medical approach, how does that affect them emotionally and psychologically and physically too?
Yeah, so just the having the disease in and of itself is traumatic and affects your mental state and your emotional state because you're embarrassed, or people thinking that you're contagious. You're having to hide the flakes, wearing light clothing so that they don't show up on your body, or maybe you won't wear shorts or t-shirts because your skin's showing. So, or having not wanting to have a close relationship with someone because you have to worry, are they going to think I'm gross? So that really increases people's risk for isolation and depression whenever they have psoriasis. um, but psoriasis affecting physical health with your obvious rash on the skin and the symptoms, it hurts, it itches, it can bleed. But like those things we talked about earlier with the arthritis and heart disease and diabetes and so on, it's truly a full body inside and out disease to contend with.
And even does temperature environment affect psoriasis too?
Yes, most people will flare during colder months. The cold
Mhm.
air kind of compromises the skin barrier. If you're running your heat or taking hotter showers, that's also compromising. If you live in a really dry climate where you don't have enough humidity, that can be tough on your skin barrier and just increase your symptoms and your patches on your skin.
You almost have to live like in the Caribbean or Hawaii or something year round
Yeah,
just to have the normal
perfect
humidity
climate.
levels, temperature, everything. Yeah, it's just not.
Yeah.
And again, I'm in Southern California. Remind me again, Dana, where you're from? Where do you live?
Pennsylvania.
Pennsylvania. So we're on both
Pennsylvania.
sides of the coast. It's like, and
Hmm.
we get our cold is like 6 degrees. We're freezing. You guys will laugh at us. Hopefully, I'm pretty sure.
Yeah.
Especially if the Eagles won, you guys laughed us all the way back to San Francisco. my all our teams. And going now, we understand, okay, the physical, the mental, the psychological limitations, the medical approach, how risky it is. What do you offer your clients? What do they come in with that initially you want to help them with?
Yeah, everyone's biggest concern is they want their skin clearer, you know. And
Okay.
then comes the joint improvements, and maybe they want to lose some weight and want some more energy. But number one, by far, get their skin clear.
Good. And how do you help them with getting the skin clear?
Sure. So I really help them understand how their lifestyle impacts their skin health. And there are ways to turn that around. And I use something called the 3C skin saving method. And that's where we address three main areas: calming the gut, clearing effects of stress, and cleaning out toxins. And when these three areas are balanced, that's really when people see the most improvement in their skin. And there's a good bit of work to do in each of those areas, but really, these are all things that people can do on their own. This is something that you don't need a medication for. If you're on medications for psoriasis, you can still do these things. And maybe you get to the point where you can lessen your medication, or maybe you're able to get off of them. But it's not a one or the other. This is something that can be done on both sides.
And with 3Cs, what is the time range you give someone to see the effect of your change?
Yeah, so I work with people over a 10-week program. And
Good.
during that 10 weeks, most people are not perfect by the end of that. Usually, when you're trying to reverse autoimmune changes, you're looking at a good 6 months. But in that time
Mhm.
frame, they will see definite improvement in not only their skin, but also if they're having some stubborn weight, that often is improving, and their energy levels are improving, the stiffness and achiness is improving. So in that time where we work together, and I like working together with people because it's
Good.
hard making these changes in your lifestyle and having someone there with you every step of the way. And we do it as a group. So you have people who are going through these same things, who get it, who have the same disease, and just having that support with each other is just invaluable. And it really helps people get better results when you have that accountability and support than just trying to wing it on your own.
And I like that because, and people don't, if people who ever had a coach before, maybe a trainer or a personal life coach, whatever it might be, you're helping someone not reinvent the wheel. You're helping them not go through the struggles that someone else may have. That point, if you do this instead, you're going to save yourself time. You're avoiding the it's not working because you're not doing the right things. You're not guessing at it.
Hmm.
And with the
Exactly.
group setting, you're helping other people understand, oh, we're feeling the same thing. It allows that. And I say the not only the association of the condition, but also accountability too. Hey, are you doing the right things to make sure that you're doing the 3Cs and whatever it might be for you to get the results that you want to get?
Right. Yeah,
And with this
exactly.
too, with the 10 weeks, I think it's way too short. I think it takes someone at least 12 weeks, even longer, to see the physiological change in their body so they can actually see that maintained versus just get a quick result at one time.
Hmm.
Walk me through the 3Cs. What do you see the most common people make mistakes in those 3Cs that you help them get through?
Yeah, so getting gut health under control is the backbone. That is massive. That's super important because if your gut health isn't good, think of your gut like a hose. If you have leaky gut, that's like having a bunch of little holes poked through. And
Yeah.
instead of things staying in where they're supposed to, they're leaking out, which causes your immune system to come and attack them, and that increases the inflammation. So if your gut isn't happy, your skin isn't happy. That's just the bottom line with that. But a big part of, aside from working on the gut, is working on people's sleep. Everyone will tell you, oh, you need to get sleep. But how can you really help someone to get meaningful sleep, and just working through the steps of not just what you do when you lie down, but what you do throughout the day to set you up for success, to be able to get your circadian rhythm back in check so that you can get the sleep that you need to reduce the inflammation and to help your immune system calm down. But how to incorporate movement in a meaningful way in your life, and how to, we can't eliminate stress, but how can we kind of check that effects that the stress cause to be able to not have the negative effects of stress, and looking at toxins that everyone's exposed to on a day in and day out basis, from what you're putting on your body to what you're using in your home. You can't control what's out in the air, but you can control your immediate environment, and trying to decrease that stress that's put on your body, and working on ways to gently detox those things out. And so doing this in a step-by-step matter, rather than just let me try a little bit here, let me try a little bit there, and a plan that's been laid out so you know where to go. You don't want to start detoxing too soon. You want to have that good base set up.
What's amazing when people don't know what they're doing, they can actually cause more harm to their body, and then they have to go to a medical doctor. Now I have more problems going on. But I like that. I think I did talk with, I think it was Beth Smith, which talked about how toxic our home can be. If you have an autoimmune condition or something like this, how it affects your body. Maybe someone who doesn't have that, for one, too, from what we put in our skin, from what we put on our and how we clean our dishes, the stuff in our how we clean our counters too. They can affect everything. And
Yeah.
going to gut health too, is there certain vitamins you recommend or certain supplements to take to allow your body to, that leaky gut syndrome, to make things want to heal that gut over time?
Yeah, a lot of, there are just generic ones you can put out, but I do think it's good to look at the state of that individual's gut with testing, doing a stool test to see where you really need the support and help. Um, as far as maybe you have yeast overgrowth, or maybe you don't have enough acid in your stomach to help you digest well. And so there's a lot of different components there, that it's not just an easy, here everyone should take this and it's just going to be the full answer for everyone.
And that's the thing. A lot of it is having that initial assessment with you being a coach allows them to know what they're doing right and what they may be doing wrong. And I'm
Mhm.
assuming French fries is good for your gut, correct? French fries?
Oh yeah, French fries, excellent.
When you said
No, thumbs
pepperoni,
down.
maybe. That's my chocolate. Oh, I don't like chocolate too, so never mind. That's my one of my favorite foods. And going
Yeah.
to topical, a lot of people had mentioned the first rung of the ladder of medical treatment is topical creams for one too. Do you recommend a natural cream or something that they can use for their skin to feel better, to get better?
Yeah, so creams are tough because they're really just kind of covering up the problem. The problem is inside your body, not on the surface. But now, if you're too dried out, that's going to increase your symptoms. So keeping your skin moisturized is very important, and using moisturizers that are non-toxic, that aren't full of chemicals that are just going to aggravate the problem further. I really like a company called Poofy, Poofy Organics. They have great options of moisturizers with organic ingredients that you're good with. And then CBD cream can also just give a quick relief. It's No cream is going to be your answer, but these are things that can just be a quick take down the itch, stop the bleeding for temporarily, the discomfort and burning, getting in the shower, just to give some relief from that. Those are just some things that can keep those scales softer.
And that's the thing, I wouldn't know that. So having you on my team allows me to get things better. You mentioned too the emotional and the psychological. How do you help them with that portion of the feeling with psoriasis?
Yeah, just knowing first that they're not alone, that I get what you're going through, the people in the group around you get what you're going through, because not everyone has a good support system at home. So helping work just through those
Mhm.
emotions together, feeling supported, having a sounding board that you can just vent off to, and just, you have a day where you just want to go cry in the shower, we'll get you through that. But whenever you're also starting to reduce that inflammation inside your body, that really does help support your brain too. Not only are the gut and skin connected, but the gut and brain are also. So by just in general reducing the inflammation, that often just helps people's mindset and mental state as well.
That's so some of your videos to going to the physicality and how we can improve our physical health. How do you help your clients understand? And are there some things that are common things that help your clients with the physicality, with exercise, with stretching?
Yeah, I find that people are either in one of two camps. They're either not really doing much, or they think that they have to just kill themselves exercising
Ah,
to get the
what's wrong with
benefit.
that? Come on, Dana. Come
Right.
on. Got knock it
No,
out.
not okay. That increases your cortisol, that increases your
Ah,
inflammation. So we really want to be in the middle of the road and incorporating some cardiovascular exercises, some balance, some strength training, flexibility. All of that matters to your body, and just teaching people how exercise can improve inflammation. And back to this whole psoriasis is disease of inflammation. They'll hear me say that a million times when you work with me, but exercise really matters. But it doesn't have to be what people think when they think of exercise. We start with people who are on the other side where they're not really exercising much. Let's just walk 2 minutes up and 2 minutes back, and then we just keep increasing that. And then once we get to 20 minutes, then let's start bringing in some body weight exercises. You don't have to have an expensive gym membership. There are tons of things that you can do at home to support your body.
what's amazing when people, like you had mentioned, that fear of I'm in pain, why would I exercise and cause more pain? When you gradually get them to feel the benefit of exercise, the motion, the movement, the reducing in cortisol, catecholamines, so your body can produce some of the endorphins to help your body feel relaxed internally. Then your body goes, hey, what else can I? What else can I do? You're giving them that space and that grace to give themselves time to build up a routine in all parts of your lives, correct?
Right. Mm-hmm.
That's all it comes down to, I think. And going through all our topics as we have done already, it looks like you give your clients a lot of hope on what else they can do besides live in, if you want to call it, a condition,
Mm-hmm.
and make that part of their, if you want to call it, their everyday life versus living a normal life and having their condition being a secondary issue.
Yeah, a huge part of why I do this is really wanting to empower people. I
Good.
want to teach you what to do and then hand it off to you. It just, rather than trying to search the internet for here, this or this, maybe I'll try this, give an exact plan and support you while you're implementing that, and then have you be able to take the reins and just move forward, and knowing what you need to do to be able to handle this on your own. And it's just knowing that you can do it and having the right tools to be successful.
It's amazing when you have a coach, and obviously Dana knows what she's talking about. You're saving yourself, like you said, hours and hours of being on the internet looking for things that Sally Mae says something over here to do, and all of a sudden Johnny says something over here to do. And all of a sudden, now what do I
Mhm.
do? So the frustration, the lack of hope, the anxiety, Dana is accountable. She'll take care of you and figure out how to help you based on what you need, and have support group with her, and her support group for 10 weeks allows, I'm going to say, to really help you get through this so you live a normal life. Agreed?
Yeah, that's
I
the
think
goal.
so.
Yeah.
Plus, are you Eagles fan or a Pittsburgh fan?
Pittsburgh fan.
Yes, Steelers, baby. Another
Hmm.
rebuilding year. I don't know why. Every year is a rebuilding year. I'm not sure what happened. And
We'll
with
get there.
and with exactly. Pickens will hopefully pick it up and pick it too. And with what's
Mhm.
going on too, what is something someone can start today besides calling you and talking to get
Mhm.
their mindset, their body right in with they have a condition of psoriasis?
Yeah, so One, just first deciding that you're ready to make changes. That's a huge mindset, is just that first step of, okay, it's time. I'm ready to put myself first. I'm ready to make these changes and nothing's going to get in my way. You need to be a determined person. And that first step is really what it takes to get that, that snowball going down the hill or the ball rolling. We just need that little push. But one actionable step, once you've decided it's time, the first thing you could really do to help your skin and your gut and your health in general would be to really consider eliminating gluten from your diet. You don't have to have celiac disease to not be able to digest gluten well. And celiac disease, for those who don't know, that's an autoimmune condition where you can't digest the gluten that's in wheat and other gluten containing products, but you can just be intolerant to where your body can't handle it well, and it can make your gut leaky with the holes poked through. So when that's happening, that's increasing your inflammation and making the psoriasis worse. And I realize, that's a big ask. That's not an easy thing for everyone. There's a lot more options out there, and it's more in, I guess, for lack of a better way of saying it, than even 10 years ago. So it's easier maybe to do that than it used to be, but it can be really overwhelming also. So just start even just with one thing. Say you always have a sandwich at lunch, what can you replace as an option instead of having your bread and cheese deli meat? What can you do instead? Can you have a salad, or can you do a gluten-free wrap? But it doesn't have to be all or nothing right out the gate. It works faster if you just wipe it off completely, but you can start with just one step, and that is replacing one gluten containing item that you eat on a regular basis at a time.
And I went to Pittsburgh back in September, and there's called the Primanti sandwich.
Yeah, Permani Brothers. Mm-hmm.
Yeah, Primanti sandwiches. Do they make those? We call them. What do we call our? Just with lettuce instead of the bread.
That's a good question. I've not gone to see if they'll make one like that or have a gluten-free option. But unfortunately, the bread's not the only health issue
Yeah,
with that sandwich.
it's a sandwich with a coleslaw. What's in the pastrami, a burger, and bread, right?
And then French fries on top.
Yes, French fries. It comes around
Yeah.
all the time. French fries. And last thing for the show too, Dayna.
Mm-hmm.
Talk about your 3-day jumpstart ebook. How does that work? What is involved in that?
Yeah, so it's just a quick way to kind of jumpstart trying to get your body calming down, that settling that inflammation and that immune response. So following those days, it gives you some meal plan recipes that are gluten-free, of course, for 3 days for
So,
breakfast, lunch, dinner. Then it talks about an easy way to eliminate just one even toxic exposure that you're encountering, and how diet matters and how stress matters. So it is just a good thing you can print off and put those recipes in your kitchen on your fridge and have them right there. It takes the guesswork out of it and gives you that jump start for 3 days to know, what in the world am I going to even do?
and I like that because you're giving someone hope, and obviously it's free. But you're telling someone, hey, look, here's if you want to really deal with your condition, it's not about the medication, the topical creams from your doctor. It's about you taking
Mhm.
care of your health and being proactive, not being comfortable, but being proactive. Understand I have to do something different for my life, for myself, for my lifestyle, for the rest of my life.
Yeah,
Right?
exactly. Yeah, and this isn't just do it for a little bit and you're done. I think these are changes to make to better yourself, to get moving towards optimal health for the rest of your life.
Good. I put out links in your show too for your website, Facebook, Facebook group, YouTube, Instagram. fountainmillsfunctionalwellness.com is her website. Again, go to the show notes. I'm going to put this on YouTube also too. People need to see this, Dayna. Okay.